This is a plain CT scan brain of a 67 years old male patient who met road traffic accident about 6 weeks ago. The patient developed left-sided hemiparesis. Now please see age-appropriate mild cerebellar atrophy. As I scroll it up, there are a typical crescent-shaped or concavo-convex chronic subdural hematoma along the outer surface of the upper part of right temporal lobe and adjacent lower part of right parietal lobe. This one here. This is a typical feature of a subdural hematoma. Now please see this biconvex hypodense lion which lies along the outer surfaces of right frontal and parietal lobes. This has resulted in marked compression of right lateral ventricle and the third ventricle. There is contralateral midline shift and subfalcian herniations. This has crossed right limb of the coronal suture. Its features are suggestive of its being extradural hematoma, being biconvex, but this has crossed the right limb of coronal suture and there is no fracture associated at this level. Chronic subdural hematomas may compartmentalize and become biconvex. This is contrary to the conventional teaching of biconvex hematomas being the extradural hematomas. So subdural hematomas, when these become chronic, these may loculate and become biconvex because of the compartmentalization. This is the coronal scan. Please see biconvex chronic subdural hematoma crossing right limb of the coronal suture, while its lower component is typical and has a crescent shape. This is bone window. There is undisplaced fracture of right zygomatic arch. There is another fracture line which has involved the posterior inferior part of right side of the frontal bone, but this fracture line doesn't extend up to the level of the hematoma. This one here. This is 3D reconstruction. There's a fracture line. This one here is involving posterior inferior part of right side of the frontal bone, and it has crossed the right limb of coronal suture, but it doesn't extend upwards up to the level of the chronic subdural hematoma.